Can everybody hear me?
Yes.
Yes,
Yes.
I can hear you.
Yes.
The adult professionals in diaspora is coming back with the 5th show on Nebo TV this weekend. Date 13th March 2021. Time 7 p.m. Nigerian time and 1 p.m. Canadian time. To present one of the most recommended topics, diabetes. Dr. Adesua Musa Eroje would give a special lecture on the different types of diabetes, the causes of diabetes, obesity and diabetes, the signs and symptoms, and the treatment. She will also present about increased blood sugar, the medications of diabetes, the monitoring of diabetes, yearly eye and foot examination, and diet. Join us this weekend on Nebo TV. A phone number will be provided to call in and ask your questions. See you soon.
Hello, hello. Can everybody hear me?
Yes,
Yes.
we can hear you.
Okay.
Right.
So if there is any noise in the background, please just mute yourself. All right. Okay. Is everybody hearing me? Everybody is hearing me?
Yes.
Yes.
we are.
Yes. Okay. Okay, my name is Nekme Obasoge, live from Toronto, Canada. We are back again with our 5th show on adult professionals in diaspora. And today we're going to treat a very important topic, diabetes. We have 5 healthcare professionals or 4 healthcare professionals with us in the studio today, all the way from United Kingdom, Dr. Adesua Musa Eroje. Hello.
Good evening.
Good evening. Thanks for joining us today. Before I will proceed to the next professional, can you please introduce yourself a little bit to the audience?
Good evening, everybody. I am Adesua Musa Eroje. I'm a general practitioner that lives in Doncaster in the UK. I have a special interest in diabetes mellitus, and I have been a practitioner in medicine for nearly 30 years, come November this year.
And today
Congratulations.
you are here to present diabetes. We can't wait. We are all prepared to listen to your presentation. We know that diabetes is a very broad topic, and we are waiting. Let me bring the next. Oh, the next healthcare professional today in the studio is Dr. Dorothy Ayela. She lives here in Toronto, Canada. Thanks for joining the program today, ma.
Thank you for having me.
Okay. Oh, the next is Dr. Nosakari Obano, all the way from California. I know that many people have been seeing him on this show. So thanks for joining the program today, sir.
Thank you for having me.
Okay, if you have anything to say about today's program, go ahead.
Today's program is going to be very comprehensive and is very, very important. And we have taken time, and the presenter has also taken time to put this program together. We are looking forward to the next one, which will be dental health. Like I say every time we do this program, Godwin Obaseki is not the only citizen of Edo State. We are all citizens of Edo State. We need to contribute to move our state forward.
Thank you, sir. So let's bring it. Okay. Pharmacist Felix Odije, he's here today to discuss about the medication aspect of diabetes, right? The treatment. Thanks for joining the program today, sir.
Thank you so much. I want to appreciate what we're doing today, and thanks for having me here. to witness this great performance that will be coming from Dr. Adesua. Thank you, Dr. Adesua. You are welcome.
You're welcome, sir.
Thank you, sir. I think you're going to be presenting the medication aspect of diabetes, right? You're going to support or join Dr.
Yeah, I think I'm
Adesua.
just in the support category. She's going to do the program.
Oh,
So,
yeah.
yeah. If there are any areas that I need to come in, I will do that.
Okay, sir.
Right? Thank
you.
Yeah.
So, before we start the program, let me quickly bring Dr. Adesua Musa Eroje. So, can you explain a little bit what we are going to discuss about today? I divided the program into 3 parts, the presentation into 3 parts. So, yeah, can you give us a little bit of the background of your presentation today? Let me bring it.
Good evening again, and thanks for having me. The title for today is different types of diabetes, and we're going to talk about diabetes. We're going to talk about the diagnosis of diabetes. We're going to show some facts and statistics of diabetes. We are also going to talk about the different types of diabetes, and then we will talk about the signs and symptoms of diabetes. Following which, we will talk about the risk factors for diabetes. We'll talk about medications, complications of diabetes, and we'll talk about pre-diabetes, diabetes in remission. We will be able to break these down as much as possible because we know that we are talking to a diverse audience. And we will want you to ask questions. Ms. Obasogie has put a telephone number so that you can post your questions, on WhatsApp or ringing. We will be happy to answer all your questions to the best of our abilities. So sit back, relax, get yourself a cup of water or tea or whatever you like to drink. And I hope that this will be a very informative and fun talk. Thank you.
Okay, go ahead.
Right. So I'm going to start, like I said, there are different types of diabetes. I'm Adesua Musa Eroje. I qualified from the University of Benin, Ugbowo, Benin City, with an MBBS in 1991. I live in Doncaster, UK, and I'm a general practitioner. I was originally trained in general medicine, and I went into general practice in 2004. I've enjoyed it so far. I want to help people with diabetes. There is an image on your screen which shows it's an image showing internal organs in the chest and the abdomen, and the red bit that you can see is the pancreas. The pancreas is an organ in the abdominal cavity. It's behind the stomach, and it's the organ that produces insulin. Insulin is produced in the body. The reason is that whatever carbohydrate, whatever food we eat is broken down by the body to glucose, and it's the glucose that is the fuel for the body, and insulin is the hormone from the pancreas that converts this insulin and this glucose for the cells that the body uses. The pancreas also produces products, enzymes and digestive juices to help break down, carbohydrates, protein, and fat digestion. Now, diabetes is where there is a problem with insulin production. Diabetes mellitus is a very complex and serious chronic condition. Blood glucose is too high due to a problem with insulin. The the diagnosis of diabetes, unfortunately, leads to a 20% rise in death rate. So the rate of death is higher. Diabetes is diagnosed, by a marker called HbA1c. Now, HbA1c is the red blood cell has got, the red blood cell is what flows in our blood, and glucose is stored in the red blood cell. The red blood cell takes 2 to 3 months before it dies, before fresh ones are produced, and so we can estimate the glucose content in the red blood cell. That is the HbA1c or A1c. A diagnosis of diabetes is a HbA1c greater than 48 millimoles per mole. In some countries, 6.5% is taken. This is acceptable by the American Diabetic Association, the European Diabetic Association, Diabetes UK, and lots of other countries in the world. We also diagnose diabetes with another test called the oral glucose tolerance test. Yeah, in this test, there's an overnight fast of 10 to 12 hours, and in the morning, the first blood sample, venous blood sample, is taken. Now, that is called the fasting blood sugar. A lot of us know about this. Our professionals or medical professionals tell us about fasting blood sugar. Now, a fasting blood sugar greater than 7 usually indicates diabetes, but it's not on its own. After the fasting blood sugar is taken, the patient is given a glucose meal, 75-gram glucose meal, normally a glass and a half of Lucozade. And then they are meant to sit down. They don't go anywhere. They don't exert themselves, and 2 hours later, another blood test is taken. Now, this blood test, if it is over 11.1 millimoles per liter, that we use, millimoles per liter is used in the United Kingdom, about milligram per deciliter is used in Nigeria. If it is over that, that's a diagnosis of diabetes. So a combination of a fasting blood sugar over 7 and 2 hours post glucose meal over 11.1 gives you a diagnosis of diabetes. Like I said, there's a line drawn in the sand. That's what is acceptable worldwide at this moment. I am going to share some facts and stats just to let us know the extent that diabetes is a global problem. The WHO released these facts and stats, the World Health Organization. And essentially, we now know that there are 463 million adults living with diabetes. 79% of adults with diabetes are living in low and middle income countries. We also now know that 1 in 5 of the people who are above 65 years old have got diabetes. That's quite an astronomical figure, worldwide. 10% of total spend in adults in health expenditure is on diabetes and diabetes-related illness. And more than 1.1 million children and adolescents are living with type 1 diabetes. More than 20 million live births, that's 1 in 6, are affected by diabetes during pregnancy. So it's an astounding, it's a shocking fact. And because of this, the WHO is supporting all developing countries and also the developed world to make sure that we put a stop to this rising global epidemic called diabetes. There are different types of diabetes. There is the type 1 diabetes where the body does not produce any insulin. There is a lack. Usually the body produces what we call antibodies to attack itself, to attack the pancreas. And so it attacks the islet cell of the pancreas that produces insulin, and there's a complete lack of insulin production. This situation, if not dealt with, is not compatible with life, because the symptoms are quickly present. They quickly come in. The patient is very unwell if you have type 1 diabetes because you have a lot of sugar. You are eating So there's lots of glucose floating in your blood, but unfortunately there is no insulin to convert this for the cells to use, for your muscles to use, for your heart to use, for your brain to use, and so they are very, very unwell. They are tired, they are thirsty, they can go into what we call a diabetic ketoacidotic coma, where the body produces toxins that are toxic to the brain because of a byproduct of fat breakdown to produce fuel. Now, the second type of diabetes is type 2 diabetes. This is a situation, the commonest type of diabetes. 90% of adults in the world have got type 2 diabetes. The body produces insufficient insulin. So insulin is not enough, or the insulin produced is ineffective. A common factor for this type 2 diabetes is obesity. Obesity, where we carry extra fat, especially in the middle of our body, can be, cause a strain on our pancreas and on our body, and so the body will start, the receptors, insulin receptors will become resistant, so they don't respond to insulin. The ability is not usually as bad. I'm trying to say that the onset of type 2 diabetes to the diagnosis can be slow in a lot of people, unlike in type 1 diabetes. We will talk more about this at a stage, because this forms the bulk of diabetes. Now, the next is gestational diabetes. As this gestational diabetes is diabetes in pregnancy, usually from the middle trimester. Pregnancy is divided into 3 stages every 13 weeks. So the first 13 weeks, is early pregnancy. The middle 13 weeks, so from week 14 to 26 is the middle trimester. And the last 13 weeks, from 27 weeks to 40 weeks is the third trimester. So diabetes that occurs usually from the middle trimester is gestational diabetes. I mean, it can cause a lot of problems for both the mother and the baby. There can be congenital, so problems with development with the baby. Mother can be unwell. Usually, it is managed with insulin. Although now we started to give pregnant women with type 2 with gestational diabetes metformin. The next diabetes is type 3C diabetes. Usually, this is diabetes resulting from inflammation, so swelling of the pancreas. The commonest reason for this is alcohol. So excessive alcohol can, in people that are prone, cause a damage, inflammation and swelling and damage to the pancreas. The pancreas produces insulin. So if there is a damage, then obviously you will have diabetes. It is a debilitating problem as well. Other causes of type 3C diabetes that's caused due to pancreatitis is a condition called hemochromatosis, where there is excessive iron deposition. That is thankfully not so common in our part of the world, but it's very common in Ireland. About 1 in 8 of them have. Prostatic cancer will also cause type 3C diabetes. There are other uncommon types of diabetes, part of the diabetic syndromes, like the type 1.5, which is the latter, is a latent autoimmune diabetes in adults. There's a family history. It happens between the ages of 30 to 50, and they show both type 1 and type 2 characteristics. The MODY is the maturity onset diabetes of the young. There is a genetic component to this, so there is a family history usually, and it happens before the age of 25, and they do respond to sulfonylureas. There's a group of tablets like gliclazide, like glimepiride, glibenclamide. Neonatal diabetes is diabetes that occurs in the first year of life. It can be transient, where it is very short term, especially in premature babies, because of the stress of incubator and all the care they get, but at the same time, we can also have, a long-term debilitation lasting into adulthood. Steroid-induced diabetes is diabetes caused by, the steroids tablets. They have some medical condition like asthma, like rheumatoid arthritis, like some bowel condition like called Crohn's disease or ulcerative colitis, where they give steroid tablets. Steroids are anti-inflammatory tablets. Unfortunately, they cause weight gain, especially in the middle part of the body. They cause insulin receptor sensitivities, and so, and they lead to diabetes. Antipsychotics are drugs used to treat mental health problems, like depression, like schizophrenia, like mania or hypomania, those psychotic illnesses. The drugs used to treat them will also cause diabetes. Because some of these drugs stimulate the appetite, so these patients become obese, and that can be a strain to the pancreas. Cystic fibrosis can also cause diabetes. Again, it's not common in the black race, but it's a genetic disorder, very common in the Caucasian race, and almost 1 in 8, where there is a block of all their ducts. There's a lot of suffering and debility, chest problems, diabetes, because, the pancreas is just there as an organ, it's not producing anything. So these are, a summary of the different types of diabetes. The common symptoms of diabetes are thirst, excessive thirst. These symptoms are really because of the high sugars in the blood, because of, absence of insulin or impaired function or lack of production. And so there's high sugar, your body is not able to utilize the insulin, there's sludging in the blood, and so the patients are very thirsty. They are drinking a lot, and then they are peeing because the body switches on the kidneys. The kidney is the organs, a pair of organs at the back of our abdomen that helps us to filter excess fluid and toxins from the body. But that is switched on when our body is sludged, with high sugar. So there's excess peeing. They go to the toilet a lot, and we are taught, and we know that in diabetes, there is tiredness because of starvation in the midst of plenty. Your blood is high with sugar, with glucose, but you're unable to utilize it. That makes you very tired. They just want to rest. They want to sleep. They are also thin. They lose weight. They've got blurred vision because we've got fluid behind the eyes, and that fluid is full of sugar. So the vision is quite blurred. Another common symptom of diabetes is thrush. Because of the high sugars, in the genital area, the yeast organism called Candida thrives, and it causes itching symptoms. Also, some patients may get recurrent boils, because of, the blood is full of sugar. The bugs love where there's sugar. There is delayed wound healing as well because of the same reason. Where there is lots of food, lots of glucose for the bugs, they will go and inhabit there, causing delayed healing, causing prolonged infection, and can lead to, poor blood, poor circulation, gangrene, and all sorts of things. Another common complication is tingling of the extremities. That can be due to two things. One can be because in diabetes, because of the high sugar load in the blood, there is swelling or inflammation in the lining of the blood vessels that carry this blood, and that can cause reduction of blood supply to the extremities, so the hands and feet. It can also affect the blood supply to the nerves, so lots of diabetes can get tingling, or numbness. So these are, and then funny enough, 6 out of 10 diabetics have no symptoms. So they just went for a routine medical, an annual, yearly medical, an employment medical, or they're in hospital for something else, and doctor decided to add a blood sugar test, and they were found to be diabetic. These ones are normally quite difficult because they don't accept. They know people who are diabetics who are ill, and so to have no symptoms, it takes a lot of psychological support and counseling. I will use this opportunity to say that if you are diagnosed as diabetes, you cannot manage this on your own. You must be registered with a an appropriate healthcare professional, a doctor or an experienced diabetic specialist, nurse practitioner to support you. It is not one to do on our own. Also, you have to have a good pharmacist to advise you on your medication. There is a multidisciplinary team approach to management of diabetes. We have dietitians, we have exercise therapists, we have psychologists. We will talk about that as we go along. The next thing I'm going to talk about is the risk factors for diabetes. Now, because diabetes is such an important and serious chronic condition, research has been done worldwide, and we now know that there is something that makes some people prone to having diabetes, and that's quite good, because once we know what possibly is associated with it, we can adjust these factors. The first one is age. The older we are, the more prone we are to diabetes, to having diabetes. So in the Caucasian population, from age 40, there is more proneness to type 2 diabetes. In the Black race, in the Asian population, from age 25. I'm talking mainly about type 2 diabetes, because that is the 90% of the population, right? The ethnicity also matters. I've said that, just like I mentioned the age, ethnicity matters. Like I said, the Black race, we are 6 times more prone to having diabetes than the Caucasian, just like, the Asian population. The family history is also very essential, unfortunately. Diabetes is an inherited disorder. So if your parent has got diabetes, either of your parents, or if you've got a sibling, so a brother or a sister who has diabetes, or if you have a child who has diabetes, I'm afraid to say you are very prone to diabetes. You've got to take good care of yourself, good care of your health. Okay, some people just have high blood glucose level. They go for a routine test. Those people are prone to having diabetes. They should watch it. Diet is also, a risk factor. So high caloric diet. I mean, we, worldwide, depending on where you are, high carbohydrates are bread, rice, pasta, starch, gari, a lot of our staple food are high in calories. Also sweets, chocolates, fizzy pops, At the same time, let's be careful, because we have natural sugars, fruits, excess fruits can also cause it. So the diet is very, very important. So we've got to take things in moderation. Obesity is a very big risk factor in diabetes. So when we carry excess weight, extra weight, especially in our middle, that's a risk factor. That's why recently, from research, we know about the waist circumference. So in women, a waist circumference of 80 centimeters or more, or in men, a waist circumference of 94 centimeters. So 80 centimeters is 31.5 inches, or 94 centimeters is 37 inches. If your waist circumference is bigger than that, then you've got to take extra care, of yourself. We can find our waist circumferences. It's not your belt. It's not where your belt goes. Sometimes we say it's where the belly button, the navel is, but some people who are very big, the navel disappears underneath the fold. So most of the time we say it is, if you take the lowest point of your rib cage and you take the uppermost point of your hip bone, the space in between that side it's where your waist should be. So a tape measure around it. This is important. It's very important. We know we women, we know about body shape. There is the apple and the pear. But let's be careful. We know that if we can reduce our waist circumference, we can prevent diabetes, hypertension, and lots of cardiovascular disease, so heart disease and stroke disease. Alcohol is a risk factor for diabetes in a lot of ways. Okay, alcohol can affect your. It can can wipe out, cause inflammation of your pancreas. Also, excess alcohol is associated with a lot of other medical condition. So you have gastric problems, you have dementia, you have stroke. So it is all in moderation. They tend to say anyone who has more than 14 units of alcohol, is prone to having diabetes. Smoking is also an important risk factor for diabetes. Not just diabetes, but heart disease, strokes. So we always encourage people to give up smoking. And like I said earlier, with the types of diabetes, gestational diabetes is a risk factor, because if you have gestational diabetes, you have to have a yearly blood test, fasting blood test, HbA1c test every year, because studies have shown that 7 years after your index gestational diabetes, almost 70% of the women end up having type 2 diabetes if they do not stop the associated risk factors. Other conditions that will increase your risk of diabetes are polycystic ovaries, mental health conditions like stress, like depression, like schizophrenia, like mania, bipolar disorders. And then we've just had the pandemic. We still are in the pandemic. We've all been told to sit at home. We've isolated. So a sedentary lifestyle, unfortunately, makes one prone to diabetes in a lot of ways. You are not moving. Your metabolism is quite slow. You put on weight because you are eating and not breaking it down. So actually, we now say that sitting down is the new smoking, because the risk factors are almost the same. Surprisingly, sleep disturbance, if you have disturbed sleep, you are at an increased risk of having type 2 diabetes. I will stop here for some questions.
Thank you, Dr. Adesuwa. Wow, you are so passionate about this topic. Interesting. So I have one question. I have one question here.
Yes.
Hello?
Yes, please. Yes, please. Okay. I can hear you.
Okay. What do you think will be the factor that will limit the body from producing enough insulin?
Okay, that's a very important question. Thank you so much, Nekmen. One of the main factors that will limit the body from producing insulin is obesity. When you are carrying a lot of weight, especially in your middle, the insulin doesn't go in pipes. It goes straight into the bloodstream, but it does work with something we call receptors, special sensory cells that sense, to allow the glucose in the blood to be utilized by the cells. Now, if you are carrying a lot of extra weight in your middle, there is, those insulin sensors become resistant, they become dormant, they don't act well, and so your body will not produce enough insulin. Okay? Your body will not. So obesity, that's why we must do our best, to avoid that extra weight. We can do that by restricting our diet and by moving, don't keep still, keep moving. I mean, I'm not saying you should go on a 100 meters dash, but you can start, count your steps. A lot of us worldwide have got smartphones that have that can count your steps, so you can start with 300 steps and, at your own pace, doing what you like best. Because obesity, it doesn't only cause diabetes, it causes a lot of other things, cancers, heart disease, strokes. So it is a killer, that we've lived with for so long. I hope I've answered your question.
Yes. So what is the major factor of diabetes? The major one factor of diabetes?
Well, what do you mean by the major factor? Are you saying the major cause?
Yes, the major cause of diabetes. Across all population now.
Yes, yes, it is across all population. Thank you, Nekmen. The major, I mean, diabetes is a complex disease, so there is no one cause. Yes, the family history is important. The environmental factors are important. With type 1, the body just produces what we call antibodies that go against itself. So it just destroys the pancreas, destroys the cells that produce, but otherwise it's not. If it was one factor that causes diabetes, then we won't have a problem. But it is a summation of all these risk factors that I've talked about.
Thank you.
Just to add a little bit to Sister Nekmen's answering that question, insulin is like putting a key in your door. When you put the right key in the door and you open it, the door opens, you can sit down, you can use the toilet, you can turn your TV on. That is how insulin functions. And then secondly, another factor that can decrease insulin will be alcohol. When you drink alcohol so much, you get pancreatitis, and your pancreatitis can destroy your pancreas, and those cells will secrete less insulin.
Wow.
All right. Okay. Can we go on now?
Mr. Felix has something to say.
Okay. Yeah, I just want to add to what the presenter, Dr. Adesua and Dr. Barnum have just said. Alcohol, you see, these factors, you have the race, like white people have more of type 1 than the blacks. Then you have other factors, environmental and all kind of stuff. But this alcohol, why it is important is that alcohol is taken all over the world. Now, alcohol is metabolized by the liver. It is worked on, cooked, and taken out of the body by the liver. And now the liver is directly linked to producing sugar for the body. So if the liver is already getting overwhelmed by the usage of alcohol by this person or by the victim, it means it will no longer be able to do much as it should to regulate the amount of sugar that leaves the liver to the entire system. So alcohol is really, that's why she's stressing it here, is people in our state or whoever is listening to this must also take that into consideration.
Thank you.
Thank you.
I have a question from Success Osaibovu.
I think we'll do that at the end.
Okay.
We'll take the question from the audience and
okay, it's relating to what was being said. That's why I said
okay. Go ahead and just say so. Go ahead, ma.
From Success Osaibovu. He says, thank you, Dr. Adesua. Why are diabetes common in adults of 65 and above? Does this mean that the insulin in the body becomes inefficient as one grows old?
Thank you very much, Success Osaibovo. That's a very important question. Yes, the natural history of diabetes, I didn't mention that at the beginning, even of the natural history of the body is that as we age, the beta cells, the beta islet cells of the pancreas that produce insulin, they dwindle, so they die, they get tired as we age. That's why, from 1 in 6 people over the age of 65 do have that diagnosis. So they are producing insufficient insulin. Yes, you are very right about that.
Mm-hmm. Maybe I'll wait till somebody's asking about the causes of diabetes.
Okay. Yeah, we'll take that. Take that at the end. Yeah. So, Dr. Dorothy, do you have anything to add to the discussion?
I think most of the questions have been answered very well and detailed as explained to the population. So it is. I would say that we need to break it down in a very simple language that our audience can understand. So yeah, those are all being done. So
yeah,
good job.
We'll discuss about that at the end of the program, where we'll take questions from the audience and break it down with a simple language so that people will understand. Because this topic is very important. Diabetes is a very common disease in our society today. So we'll be right back and continue with the discussion.
The adult professionals in diaspora is coming back with the 5th show on Apple TV this weekend. Date 13th March 2021. Time 7 p.m. Nigerian time and 1 p.m. Canadian time. To present one of the most recommended topics, diabetes. Dr. Adesua Musa Eroji would give a special lecture on the different types of diabetes, the causes of diabetes, obesity and diabetes, the signs and symptoms, and the treatment. She will also present about increased blood sugar, the medications of diabetes, the monitoring of diabetes, yearly eye and foot examination, and diet. Join us this weekend on Nebo TV. A phone.
Okay, so we are back. For all our viewers today, it's like this thing is echoing.
A little bit, it's okay.
It's okay now. Okay. So for all our viewers, I provided a phone number that you can call in at the end of the presentation because we are still in the middle of the presentation right now. Towards the end, I'm going to on the phone so that people can call in and ask questions. I know that not everybody really wants to type and ask questions through the text messages. So that is why we provide a phone number for today's program. Okay, so I'm going to pull out the presentation. Yeah. Okay, go ahead. The next slide, ma.
Okay, thank you very much and welcome back. I hope you had a quick comfort break. Please keep in mind, I mentioned the risk factors for diabetes. We will go back there because that's important when I talk about pre-diabetes. Next, I'm going to talk about briefly on the treatment of diabetes, right? Type 1 diabetes is treated well. There's an insulin lack. There's no insulin at all. And so it's treated with insulin. This is either as injection form where you inject. Some people are also giving insulin pumps. But in all this, there is a very intensive blood sugar monitoring, because the blood sugar needs to be at a certain level. Insulin, it's either given once a day or twice a day or 4 times a day. Your health professional will look at your lifestyle because the management of diabetes is individualized. So we are looking at your lifestyle. Are you an active person? Do you have regular or irregular meals to choose the kind of insulin that will benefit you? But there is a good and intensive educational support with dietitian, with calorie counting, diet is so important here. With exercise, you have to keep moving. Not only do we talk about that, also, in managing the insulin, we also want to control the blood pressure and the cholesterol. Now, in the developed world, there are lots of islet cell transplants. So some people get pancreas transplant from, people that have unfortunately passed on, immediately after they pass on, or people that are brain dead. That does work, but ultimately, these patients need insulin. As for type 2 diabetes, at diagnosis with a HbA1c of 8 millimoles, it is, the health professional speaks to the patient. Metformin is the first medication that is started in addition to intensive lifestyle change. Previously, we said it was just intensive lifestyle change, but we never saw these patients. So for us in the United Kingdom, most parts of the developed world, diet controlled diabetes does not exist anymore. The reason is that there is a lot of cardiovascular, so the heart and the brain cells, they do suffer if you don't appropriately treat. Now, this metformin is one of the first tablets that was produced, to help diabetes. What it does is sensitizes. I said that the insulin receptors are tired. They are not as, they don't react to sugar in the blood to produce for the insulin to work on. So they sensitize these insulin receptors, and they encourage weight loss. They cause, glucose production from the liver to, they regulate that as well. So it is quite a good tablet that we give, but there are pros and cons to giving metformin. In that, if your kidneys are not working well, the kidney test is a test called urea and electrolyte, where they can also calculate GFR. If it's at a certain level, then you will not be giving metformin. But intensive lifestyle, because diabetes has to do with education. We know that if we give intensive treatment in the first 5 years following your diagnosis, then your outcome will be good. Complications will not set in. So there's intensive, in the UK, there is 4 hours of intensive education. It's normally in a group setting within the first year of diagnosis of diabetes. There are lots of classes that they do where you see psychologists, because some people, they find it difficult to accept the fact that they are diabetic. So they have psychologists, they have exercise therapists, they have dietitians, they have, physiotherapists. So the whole multidisciplinary team to support them, so there's intensive, the aim is for weight reduction. That's so important, because I'm not saying there are not type 2 diabetics that have, that I'm not saying that it's every type 2 diabetes that has a high weight. Some of them, just because of their family history, no matter what they do, they will still get it. Environmental factors, medication they've had to take. So there's intensive, therapy, exercising, diet. We tend to say, eat with a smaller dinner plate. Most of us, of the black race, we like block eating. We like to fill our tummies with a high caloric food, pounded yam, rice. I'm not saying we shouldn't eat it, contrary to what people think, but we say half or a third of what you should normally eat. The best thing is to have a smaller plate. So half of your carb, you can have as much protein, but bulk up with vegetables. Watch the fruits, because fruits are, natural sugars. And if you are diabetic, not too good if you have too much. We always say just a portion of fruit a day is enough. I will always say avoid honey. It's a complex sugar. Forget that it's natural. I would also say avoid fruit juices, because all these firms, they add all sorts of additives that are not so good for us. So there's intensive lifestyle changes. We also, look after the blood pressure and the cholesterol. That is the breakdown of fat. We encourage smoke cessation. What at diagnosis, there is an annual diabetic foot check. So your feet are checked by the nurses. You are told not to walk barefooted, because your feet may be numb if the nerves are affected. So if you get a puncture, you may not be able to, be aware of it, and it can get infected. We also have the annual diabetic eye camera screen. So at diagnosis, and every year, patients are sent to the eye specialists. They have a team where they have a look, a camera to look at the back of the eyes, because the blood vessels at the back of the eyes can be affected, and diabetes is still the 3rd commonest cause of blindness. We also advise an optician assessment. The patients, access opticians in the high street. For as soon as they are diagnosed, we tell them to make sure they go every year. We tell them not to change their eye prescription for the first 3 months, because sometimes the problem may just be sugar in the jelly behind the eyes. Diabetes affects the eyes in a lot of ways, and we'll talk about that. So again, I will reiterate, this slide is talking about healthy eating. Like I said, a lot, bulk up with vegetables. That's the fiber. Cut down half or a third of your carbohydrates. Continue with your protein and just a little bit of fat. We still need it to some extent. Okay, right? And walking is healthy. We want you to walk. For those who are unable to walk, they are chair-based exercises where you can tap your feet, where you can wriggle, balance exercises are good, counting your steps are good, but we need to lose weight. I cannot more than stress that. In any way you like, choosing what you want to do, take the stairs instead of taking the lift, park your car. If you are going to the supermarket, park your car far away so that you can have that extra walk. Carry your shopping in your hand so that, you can, it's all weight training, it's all trying to lose weight, doing the bit that you can. Stop one bus stop before your house and walk the rest of the way. It is a habit, I don't expect you to go from 0 to hero in 5 minutes, but it's the determination, and it does work.
Yes.
So let's eat less, let's move more. It works, like I said, it works. Right. Now, the next thing I'm going to talk about briefly is on the oral medication. Okay, we have injectable medication for diabetes, which is insulin, and there's another injectable called GLP-1. Okay, now type 2 diabetes can have insulin. Okay, like I said, therapy is individualized, so it depends on you, on your makeup, on if you've had high blood pressure, on if you had heart disease, on if you have kidney disease. That depends on the kind of medication you can have, on how high, your sugars are, on if you are a commercial driver, so every not one size fits all, and day by day, in fact, we say after metformin, the choice for medication for diabetes is a buffet. So the choice is there depending on what you have and what you want. Some put you weight on, some cause weight reduction. Some you cannot have, some you have to, you cannot, you have to check your bloods before you start driving, and every 2 hours while you are on the wheel. So it depends. So it's not something a decision you can take lightly. You must go to your health professional, sit down, and they have a chat with you. I'm happy to take lots of questions about medication, because if we start to take each medication on its own, that's a big topic on its own. In fact, it's a major topic on its own. But there are major classes with different side effects. There's the latest kid on the block, the SGLT2. There's the old one, the sulfonylurea. But these days, like I said, we always pick a medication based on, have you had heart disease, stroke? Does it affect your kidneys? So it's individualized care that we talk about now. This slide talks about how the medication work, and in the question time, I will go back on it and be able to answer your burning questions.
Okay, we have to stop there. We have some few questions.
Okay.
So we'll come back to the third session of this presentation today. I have a quick question there. Through dieting and weight loss, can diabetes be reversed?
That's a lovely question to ask. If you had asked me this, 10 years ago, even 8 years ago, I would tell you, no, diabetes is a long-term condition. I will tell you, you are with it for life. But now, medicine, like we all know, is not static. It's very, very dynamic. So we know that, there's something now called diabetes in remission. Okay, it's a new thing. It's been on in the last, especially in the UK and in the US and in Europe, really, it's been a thing in the last 4 years, 3-4 years. It's called diabetes in remission. That's where if you can lose between 5 and 15 kilograms of your body weight, then it's not just you losing the weight, monitoring your blood sugar, sticking to the diet, exercising, your doctors, you will find that your HbA1c, that's your monitoring test, starts to reduce. And when that starts to reduce, in time, your doctors will start to withdraw your tablets. So it's not something you can do on your own. No, it is something you do with your clinician. But yes, it is now possible. It is now possible.
Okay. One other question here. I saw some presentations online saying that vegetables, especially the common vegetable in Nigeria, bitter leaf, can help to reduce diabetes or cure diabetes.
All I can, Well, it's a good question. It will stimulate lots of thoughts. I would not want to deceive anybody. The role of vegetables in diabetes, I would not say it cures. I would be telling lies. You know, we haven't got. I mean, medicine is evidence based. Okay, so yes, vegetables have a very good role. They help us. You know, they are bulk formers. They help our digestion. You know, if we eat a lot of vegetables, it reduces the amount of calories of carbohydrates we need to take. So they help, but I would love to agree with you. The internet has got lots of sources that are not verified, Netman. So we've got to be careful. I would not want somebody to hold on to the fact that bitter leaf helps diabetes and not take their medication and run into problems. Because if you do not take your medication, you will get complications that are not reversible, I'm afraid.
Okay, what role do you think this bitter leaf can play in this diabetes?
I will be very frank. As a medicine for diabetes, I am yet to be made aware of the role. But as a vegetable to help with bulk forming, to produce minerals and vitamins, yes, I know about it. I'll be very frank with you.
Oh, thank you. Thank you for that question. Okay, so let me bring. Oh my God, what?
I have a question here.
Yes, ma'am.
Oh, are you asking or shall I ask?
Ask. Go ahead.
There's a question here from Osaz in Noma. He says, what causes diabetes? Then he went on, or she went on, I don't know if I think he's a man. The causes of diabetes differ depending on the type. Type 1 diabetes occurs when the body's immune system mistakenly attacks and destroys the insulin producing cells.
Unmute yourself. Unmute yourself, Mr. Felix. Unmute yourself.
Sorry, Dr. Adesua, please, can I just answer that question?
Yeah.
I don't think we really need to dwell on that question now. Before, at the beginning, in inception, she dealt on all types of.
She's asking again.
She dealt on this question. So we might really have to
skip
ahead
it
so that we don't lose track. Yes.
Okay, let's just focus on this question, the one I just asked.
I think we should. There are too many questions at the
side.
Questions
towards the end. The
next.
Yeah.
Will you be able to share the slides? Will our audience be able to access the slides? Because these slides are very important.
That's what I just wrote that to
I do not want anybody to leave feeling that their questions are not answered. So if they can access the slides from your website, from YouTube, then they will answer their questions can be answered, especially where we've answered the questions before. Okay, but thank you very much.
They can rewatch this program from the beginning again.
Yes, and most of the answers will be answered.
I can post it like a picture format on my social media handles. That people can access it. I will do that after the program. So if there is any question.
Thank you, Ostaz Enoma. Thank you for that question. And I'm afraid we've answered it extensively at the beginning. In fact, you have answered it. You were already talking about what type 1 diabetes is. So well done for your information.
Dr. Bano, go ahead.
You're muted.
Diabetes. There's been a lot of hype on washing bitter leaf and drinking because it's bitter. And people feel that anything that is bitter is supposed to help you cure diabetes or is supposed to be medicinal. That is not true. And I remember growing up as a kid, when you have a stomach pain, your parents would take a bitter leaf or a bisugu, squeeze it up, put some salt, and then you drink it. And then there goes your belly pain. But people are not understanding that what your parents are doing are putting salt in that liquid, and that salt is replacing your electrolytes. And that your electrolytes is what is helping you and helping the stomach pain. The same incident goes to bitter leaf. Bitter leaf has been touted by so many. And I think a prominent man in Nigeria is putting out money for more research on this bitter leaf. Like our presenter, Dr. Adesua said, it will form as a bulk. And then my feeling is that sometimes this bulk things that we eat do bind with antibodies. And as they bind with antibodies, then the antibodies are taken out of the body. So that's where bitter leaf may become a little bit, or vegetable may become more helpful, where antibodies that are prone to attack the better cells are bound by these vegetables as a bulk forming issue. So I think that's it. But in terms of bitter leaf, drinking bitter leaf and not taking your medicine, I think somebody is driving in the wrong road.
Okay. Yeah. I would just also add that green vegetables, especially if you squeeze the juice, that's a high vitamin C and folic acid. So that's excellent. The body, like I said, there's a production of minerals and vitamins that the body needs. But that's all I will add. Thank you very much.
Okay. Is there any other question? Not from the comment section, though. If there is any other contribution or question here. No one? Okay. We're going to go on a quick break and we'll be right back.
The adult professionals in diaspora is coming back with the 5th show on Nebo TV this weekend. Date 13th March 2021. Time 7 p.m. Nigerian time and 1 p.m. Canadian time. To present one of the most recommended topics, diabetes. Dr. Adesua Musa Eroji would give a special lecture on the different types of diabetes, the causes of diabetes, obesity and diabetes, the signs and symptoms, and the treatment. She will also present about increased blood sugar, the medications of diabetes, the monitoring of diabetes, yearly eye and foot examination, and diet. Join us this weekend on Nebo TV.
Okay, we're back again. Hello?
Hello, welcome back, and thank you very much.
So let's go to the last part of this presentation before we start taking questions from the audience. Go ahead, Ma.
Yes. I'm now going to talk about the complications of diabetes. Good diabetes management reduces the risk of complications. Complications are the fallout, the negative effect of poorly managed diabetes. So if you don't manage it well, that's why you need a clinician, a qualified clinician, to see you at least once a year, but I would say twice or 3 times a year. But once a year, if that's what there is, it is good to monitor you, to have your blood test done, and then to plan for the future, to have your food tests. Right. Now, the complications are as a result of poorly managed diabetes, and there are lots of factors that can cause that, especially psychology. A lot of patients feel, oh, I don't have any symptoms, so I don't need to take the drugs, and all sorts of things. However, I would still stress that a diagnosis of diabetes, it reduces your longevity, so if the person was supposed to live to 100 years, if because of just the diagnosis of diabetes, then they will die at 80 years, so because of that, we want to be very careful. But not just that, not just quickening death, there's also the worry of heart attacks and strokes because of the high flood of sugar in the blood vessels. We always say, we clinicians, that a diagnosis of type 2 diabetes, especially when you look in the blood vessels in the heart, it's like the person has already had a heart attack. They are patchy and they are thin because the blood vessels they are inflamed, they are swollen, and then, the fats content in the blood causes hardening of these blood vessels, so makes you prone to heart attacks, to strokes, and also in your lower legs and in your upper legs, the blood vessels become hardened. And so there is less blood supply to your legs. And so, you can have poor circulation, and you can have numbness, and you can have ulcerations and gangrenes, and amputations. Now, there is also Diabetes can affect the small blood vessels. So it can affect the eyes, called the retinopathy. But not only does it affect the small blood vessels of the eye, diabetes it can cause cataracts, it can cause blurred vision, it can cause glaucoma, it can cause new blood vessels forming at the back of the eyes, and this can cause retinal detachment and blindness. Diabetes can also cause poorly controlled, also cause kidney problems. The kidneys, essentially are the filter of the blood. So they filter and get rid of all the toxic substances, all the things that are harmful to our body. Now, when you have diabetes, because of the swelling of the blood vessels, in the blood, in the kidneys, you are able to now filter protein, which are essential in your blood, for your body. You filter it out, and it is a marker for chronic kidney disease. There's a disease called chronic kidney disease, and it's very popular. It's very common in diabetics. So because of that, at least once a year, we check an early morning urine sample to check for this low protein in the blood, in their blood, and that determines on us giving them some particular medication to balance out and reduce this excess protein loss. Another complication, is the neuropathy. So the nerves can be damaged. That can be from blood supply. If the blood supply to the nerves is damaged, the patients, can have numbness in their hands, in their feet, weakness, pain. Sometimes there is diabetic pain neuropathy, so the body is so painful, the leg or the arm. They try all sorts of painkillers and it doesn't help. It can cause arthritis, joint disorders, and weakness. Okay, this numbness part is so important. That's why we always stress: see your nurse once a year for the annual check, so she can check for the circulation in your leg and check for the sensation. And also we stress that diabetics should always wear slippers at the very least, so not to go around barefooted. If you have numb legs and something pokes you and you are not aware, it can get infected. There is delayed wound healing. There is gangrene, so the flesh will die off because there's poor blood supply. The bones can also become infected. And that is the common cause of amputation. We all know somebody or another that has had diabetes, that have had a leg taken off. It is because of this. So it is so important. Diabetes also causes dental problems. Gum disease is the commonest cause of tooth loss. It's not sweets, it's gum disease. It can cause all other tooth problems as well, all other, especially they can have yeast infection as well. Leg ulcers, like I've mentioned before. Depression, diabetes commonly causes depression because of just the pressure, the lethargy, the debility. So the illness, it can be too much. It's a long-term condition. A big one is erectile dysfunction. This is impotence. This is a poor erection or ineffective erection or no erection. So actually, any man who has an erection problem, if they see a health professional, one of the tests we do is to check for diabetes, because it's very common, because it affects the nerves, because it affects the circulation. So it's one of the things that I will encourage men to open up to their health professionals, because we can treat this, and because it can cause so much problems in the home. Also, dementia is a common complication of diabetes, because it's hardness of the blood vessels in the brain, and so commonly causes, because of poor circulation, poor blood supply, it causes dementia. Dementia is the condition where there is confusion and poor memory. There are some complications of diabetes that we must mention, especially, one of these is what we call the DKA, ketoacidosis. So usually it happens where, especially it's a common one with type 1 diabetics, where they lack insulin, and there's where there is no insulin, high sugar in the blood, the body starts starts to break down the fats and other proteins to try and make fuel for the body to use. This fuel, unfortunately, is quite toxic to the brain. So you find that they go into a coma, they are comatose, they are lying down, they are confused, they are drowsy, they are dehydrated, and they have to be taken urgently to the hospital so that they are treated with, intravenous infusion. So drips, as we know it, and insulin, Hypoglycemia, so that is low sugar, is also a complication of diabetes. Either people take insulin and don't take enough food, or they take their medication, their diabetic medication, and don't take enough food. So hypoglycemia is characterized by tiredness, confusion, shakes, so they're having tremors, they are shaking, they are very hungry, severe hunger pangs, they are very hungry. So we always advise diabetics, especially those who take insulin, to have some sugar products, in their pocket when they have hypo, to make sure they eat regularly, to make sure if they are going to exercise, that they eat extra, or they take some extra, glucose tablets to help them. Now, another complication is seen commonly in the elderly, where there's very high sugars. It's called HHS. So that is a hyperosmolar, so high sugar, high concentrated blood. Common in the elderly, treated with drips, intravenous fluid, and medication to manage things. So there are lots of complications of diabetes. You name it, it causes it. So we need to, be very careful to make sure we have good control. So this slide also talks about complications of diabetes that I've stressed on. Now, we cannot talk in this pandemic era. We've been on it for the last 14 months nearly now. We cannot talk about diabetes without, in 2021, without mentioning the effect of COVID on diabetes. I will start by mentioning 4 facts. COVID-19 outcomes is more severe in patients with diabetes and metabolic dysfunction. Yes, because diabetics are more prone to infection. Diabetics are they have cardiovascular disease, so heart attacks and stroke. They are more prone to that. So the effect of this terrible infection will cause them to, will cause, the COVID-19 illness to be more severe in diabetics. Also, COVID-19 will precipitate acute metabolic complications, like I just mentioned, like ketoacidosis and very high sugars. It will precipitate it. And the risk of COVID-related mortality is significant. So most people with diabetes who get COVID, they do die, in either type of diabetes. So that's why, we find that in this part of the world, most of the diabetics going to self-isolate, because we found, especially following the first wave, that as soon as they got the infection, a lot of them did not survive. Now, the surprising thing with COVID-19 exposure is that most of the patients who had COVID-19 came out with type 1 diabetes. I suspect a lot of antibodies were formed, like it's formed in COVID, in the cytokine storm. A lot of the antibodies affected, attacked the pancreas. And it led to type 1 diabetes. So yes, all aspects of life, is affected by diabetes, and COVID-19 was not left out. I promised at the beginning, when Nathan asked me a question about, can diabetes be cured? I told her that yes, in the last 3 to 4 years, I can now say yes, there is something called diabetes in remission. Okay, but I must leave a very strict warning. You cannot decide to stop your diabetes and say it's in remission. No, it is done under close supervision of your clinician, and an experienced clinician at that, okay? So you've got to lose up to more than 15 kilograms of your weight. That is serious. If you have been trying to lose weight, you know that if you lose 3 kilograms, you are jumping, not to talk of if you lose 15. So it is a lot of hard work. I mean, in the UK, they are giving patients very low calorie diet. Again, I said it's supervised. So they stop eating regular diet, they give them shakes and milkshakes and soups. That's what they give them for the first 12 months, 12 weeks, so that their tummy size can be small and they can be useful. But it is difficult. They have to have lots and lots and lots of encouragement. And after that, they start to introduce little diets, in addition to exercises. So it must be supervised. It's not something to be taken lightly, because if you suddenly stop your medication, you will have a very devastating effect. But we know that if we can lose weight, even if it's as little as 5 kilograms, you can reduce complications of diabetes, you can reduce your blood pressure, you can reduce your weight, and you can reduce cholesterol level. Okay? Now, diabetes in remission is when your sugar is below 48, so below the diagnosis, for at least 6 months, and you've had no tablet. But like I said, don't do it on your own, okay? It can cause devastating things if it's not supervised. Thank you. Right. Pre-diabetes is another thing that I would want to talk about. I would want to talk about pre-diabetes because it is so important. There's no, prevention, we say, is better than cure. That is a very common Nigerian proverb. And if we can prevent diabetes, then we can avoid the suffering, the debilitation, the health challenges, the family challenges, the emotional challenges. So blood sugars are normally higher than usual, but not as high as the diagnosis. So your blood sugar is not up to 48. So it's between 42 to 47. The patients have no symptom. They usually have a family history. So essentially, other names for pre-diabetes is at risk of diabetes, impaired glucose tolerance, impaired fasting glucose tolerance. Your health professionals will tell you about all these things, okay? But we now know that there is a diabetes risk assessment toolkit. So I want to use this opportunity, ladies and gentlemen, to ask you to, those of you who can access the internet, like we are all doing today, to go to the Diabetes UK. There is a free tool, or you can use any other tool, okay? It is a tool for diabetes risk assessment. You will put your gender, so your sex, whether you are male or female. You will put your age, your ethnicity, whether you are Black, Caucasian, or Asian. A family history in the first degree relative, your waist circumference, so make sure you have that before you go, and then presence of hypertension. And it also checks your body mass index. Body mass index is what we use for obesity. The normal is 18 to 25, and the body mass index is factor of the weight divided by the square of the height. Okay, so that has to be calculated. It's a standard anywhere in the world. Where the body mass index, like I said, 18 to 25 is normal, 26 to 30 is overweight, and over 30 is obesity. So if your body mass index is over 30, then you are at risk. So I would encourage you, ladies and gentlemen, to go and check out this diabetes risk assessment tool. But pre-diabetes, it's now an entity. It's not yet accepted by WHO, but they've not brought any information out for the last 4 years. Hopefully they will, but we are using it a lot. It is helping our patients, it is preventing the onset of diabetes. Physical activity is very, very important in diabetes, okay? Physical activity, we say start small, but be consistent. The watchword is consistency, okay? Even if you are walking around your house, every room in your house, every day, twice, every day for 1 week, twice a day, and then you build up so much that you may want to walk outside the house, up your street, down your street. We've got to start small. It is, research shows that, we need at least 150 hours a week. So we can break it down to 30 minutes every day for 5 days and give yourself a break for 2 days. Essentially, it doesn't have to be going to the gym. You can sort of, walk in your own home, balance exercises, just keep moving instead of, we always say if you've sat down for 2 hours, then you must get up and move around for another 10 to 15 minutes. That's important.
Yes.
Thank you. Any questions, please? Thank you for being patient. I know I've given you a lot of information, but the idea is that you will approach your health professional. But I am available for questions now, please.
First and foremost.
Thank you, Dr. Adesua, for this presentation. Wonderful.
Yes.
You are so passionate about this topic. How long have you been practicing this diabetes? Tell us, how long have you been treating patients with diabetes?
Really, for 29 years.
Oh, yeah, there's been a while. That is why you are so passionate. The way you are explaining, it's like, oh my God. You are just too perfect.
I want to help. I want to help. I was brought up surrounded by people who suffered with this disease. And, it's painful to watch their suffering, and not be able to do anything. So that's one of my motivator, to say, I want to help. I want to find out how I can help these people,
Oh, I appreciate your professionalism. It's so nice. Yeah, let me bring Dr. Obano to the screen. Go ahead, sir.
Yeah. Can you give me some time? For me, I think this is a very good presentation.
Thank you,
it's
sir.
Superb. And we continue to bring superb presenters to this program. And I want to say that I am very proud of you as a daughter of Edo State.
Thank you so much.
And my first question to you is that if somebody in their 70s goes to their practitioner and then they find out they are diabetes or they have diabetes, will you recommend that they check for pancreatic cancer in these people?
Well, it depends. It really depends on what other symptoms they have. Okay. It depends, if they've come and they have all the symptoms of diabetes at 70 years, yeah, we will. There's nothing wrong in doing an ultrasound scan to find out things. Okay, we've got to be careful because we are dealing with a wide audience from a diversity, of situation. Okay, so yes, a 70-year-old who's with symptoms of diabetes, I will obviously screen them. I will, treat them, make sure they don't have any underlying heart disease, kidney disease, and in doing that, an ultrasound scan can show if there's anything else going off in the pancreas. Yeah.
Okay. My next question is to our pharmacists in the audience. How will you advise people back home to handle their insulin?
Recommend. We're not hearing you.
No, we can't hear you. Yeah.
Unmute yourself, Mr. Felix.
Okay. So first of all, let me give kudos to Dr. Adesua for a job well done. I'm so thrilled. I would say here in Canada, I have seen people that were diagnosed of type 1 diabetes when they were merely 12 years old, getting to 98 years old. So if this is well managed, and if we listen to the advice of our doctor for today, you can just live as long as any normal person. So I would say that is why I'm not going to be dwelling on any medications. The first thing is go to your doctor, on healthcare professional, nurse, doctor. The doctor can eventually tell you, okay, you know what, I'm going to assign this person, the other doctor, to you or nurse. So everything begins with having symptoms of being diabetic to get it to the doctor, then ends with the doctor managing the whole stuff. I don't advise people to go to the pharmacies or chemists, buy insulin by themselves and start to use. No. If we have symptoms like excessive thirst, excessive hunger, fruity breath, odor, and all kinds of symptoms, go to your doctor. Your doctor will follow it up. If it is determined that it is type 1 diabetes that is going to be managed by insulin, so be it, the doctor will make the judgment. Thank you.
Okay, my other question to you, our pharmacist, is if somebody who is on insulin, they're traveling to, say, from Benin to Lagos or to the village, what advice will you give them on handling their insulin?
Okay. Now, the storage of insulin should be between 2 degrees to 8 degrees centigrade. So anything that is below that or higher than that is capable of damaging the integrity of the insulin. So what we advise is, or when we are doing delivery, these insulins are kept in the fridge. So it is only when you open the vial, one vial, we want to use that it can be safe for at least 30 days, minimum of 30 days. 3 months, that's fine. But if it is like you're traveling from Lagos to Benin, we advise that these people will buy ice packs and place the insulin, the pack in between 2 ice packs. So it has to be in that state until they get to where they're going and then put them in the fridge. But once they have started using one, that necessarily does not have to be placed in the fridge.
Thank you. Yeah.
This is the
insulin.
This is the picture of the insulin, right?
Yeah. They have different colors, different types. Yeah, so many now. Yeah.
Okay. So this is how to use the insulin.
The doctor the professional will teach the patients normally. We don't want people to just do this, and the professionals will teach them what to do. The nurses, doctor will teach them how to. They will be schooled, they will be taught, so they can also manage, so that they will be able to manage the injections. They know where to go and the position of the needle and so on and so forth.
Okay.
For our presenter, Dr. Adesua.
Yes, sir.
I have a question.
Yes, please.
Okay. So I just want to know, or explain to the audience as well, what is the relationship between diabetes and heart disease that can later lead to lack of circulation of blood to the rest part of the body?
Thank you so much. That's a very interesting and important question. Now, diabetes is a condition where there is too high sugar in the blood. This too high sugar causes inflammation, so swelling of the lining of the blood vessel, of the blood, the blood vessel, and there is hardening because of the inflammation. There's, because of fat and sugar. Because of the relationship between the fat in the blood and the high sugar, there is hardening of the blood vessels, of the blood supply. So when it's hardened, there is less blood flowing, to these organs. So if it's the heart, you will have heart attacks. If it is the legs, you will have peripheral vascular disease, like I mentioned. If it is the brain, you will have stroke. Okay. Yeah. Also, because of the narrowing of the blood vessels, it can cause high blood pressure. So that's why there is a very close relationship within diabetes, and heart disease and stroke and heart attacks. That's why actually when you are diagnosed as diabetes and you've reached 50 years old, we give you what we call secondary prevention. So you get some people get given aspirin, but you are definitely giving cholesterol lowering tablet because you are prone to it.
So you just mentioned aspirin. We did a program a few weeks ago about aspirin. It's almost the same. I'm not in the medical profession, but however, I'm going to play this video for everyone.
Do you know benefits of taking daily aspirin include the reduction of fever, mild to moderate pain, muscle aches, toothaches, common cold, arthritis, heart disease, and low blood pressure? Daily aspirin usage can help prevent a clot-related stroke and can also increase bleeding stroke. When arteries are already narrowed by the buildup of plaque, a clot can block a blood vessel and stop the flow of blood to the brain or heart. Taking aspirin diminishes the ability of your blood to clamp.
Okay, you saw that. I'm right. Almost the same thing that we are discussing about right now. Yeah.
Yeah. But I will just give a caveat here, please. Anybody who is older than 65, before you take aspirin, I would ask you to see your clinician, your healthcare professional, because aspirin, although it does all that good work that it's talking about, it also causes swelling of the lining of your stomach, so you can have bleeding ulcers. So it's very, very, very important. Okay.
Okay. So,
I
any
have
I have a
question?
question.
Yes, I have a question, please.
Yes, ma'am.
There are a lot of questions today.
No. I just have 2 short questions, please. Between diabetes type 1 and type 2,
Yes.
which is a better one out of the 2 evils?
One is good. One is good.
None of the above. Actually, I would say none of the above. You don't want any of them. You don't want any of them. Yeah.
I mean, the one that is more dangerous. Yeah.
I can almost say it's type 2.
Type 2, okay.
It's more prevalent.
I can almost say it's type 2. Yeah. Yeah.
Okay. Then my second
Dr. Adesua,
question
you
is,
mentioned about drips.
Yes.
So if a person in Edo State goes to their doctor and the doctor says, I'm giving you drip, I personally will be finding out what kind of drip the doctor is giving me. So can you clarify what kind of drip people should be expecting when they go in for diabetic complications or diabetic problems?
Well, it depends. I mean, the main reason where, if they have what we call the diabetic ketoacidosis, so type 1 who suddenly collapsed because, there's no insulin and they were not known to be diabetic and there's high sugar in the blood, you give them normal saline. Okay, you give them normal saline. That will hydrate them. At the same time, you also give them insulin. You've got to correct the electrolyte problem, so the salt problems, and also, bring down the sugars. Yeah.
can I ask my second question now, please?
Yes, ma'am.
If somebody has cancer, pancreatic cancer, and at the same time is also diabetic, what are the chances? Can you just explain a little bit more about that?
I will tell you, unfortunately, pancreatic cancer is bad news for every clinician. It's something dread. It's difficult to identify and it's difficult to treat. That's why it always presents at a very late stage. Okay, I will be very frank about that. Okay. Now, yes, where we can find pancreatic cancer in diabetics who have been well controlled for a long time, and then suddenly they get, that's the usual way. Suddenly they get very, very, where HbA1c has been 48, 50. Suddenly it's 112, and they've done nothing. They've done nothing, but then they may not tell you, oh, I've been feeling tired, oh, I've been losing weight. Those are the triggers, okay? And also, there is also, the commoner pancreatic cancers, that we find in the elderly, the presentation will be, they'll be jaundice, they'll be yellow, and there's no pain, we can find that. But where pancreatic cancer coexist with diabetes, we treat with insulin usually. Unfortunately, it's not very good news.
It's not good. So the person most likely will die.
Unfortunately, yeah.
Okay.
The lifespan with pancreatic cancer is normally 12 months, isn't it? That's why it's always it's not good news. I always dread having to tell anybody that their diagnosis is pancreatic cancer.
Thank you very much.
Okay.
You've done wonderful.
Well done.
Very proud of you.
Today's program is just
Yeah, you look more like mommy.
Amazing program today, honestly.
Yeah.
Thank you so much.
There
Thank
are
you.
many
Like
questions.
so many comments about how wonderful you are, and like very informative, interesting. We've learned a lot. It's all
Thank
kudos
you so
and
much.
accolades.
I use this opportunity to thank everybody, Dr. Ubano, my auntie, Auntie Uki Obaseki, Dr. Dorothy Ayela, Mama Sister Digie, Miss Netme Obasogie, and if you many row work, any receipt, kakabo, no one
I think there
I
are.
just sent you a Facebook request, okay?
Thank you to
Doctor, this one I just sent you a Facebook request.
Okay, all right.
And somebody is asking to post your presentation. Is that all right with you?
Yes, post it. It's
Yeah.
to help. The idea is to help our people.
Yes,
A few people are asking for it.
Yes, it will help.
And
It will help. And they can connect to me through Nekme. Nekme, they can send questions to Nekme at Nebo, and she will direct those questions to me. Thank you so much. I've had such a lovely time. I do like, like you can see, talking about diabetes a lot,
Yeah.
I like helping.
Yeah. So there are. I know that there are many questions or comments for you in the comment section. Mrs. Ukinebo Obaseki, is there any question there that we can?
I've asked the ones that the person that wrote the most questions actually asks questions and answers them. So Mr. D just said no need to read those ones. No.
Oh, there are many comments here. A lot of comments.
They are mostly well done, doctor.
Commentary.
No,
okay, there are more commentaries.
Oh, okay. Type 1 and type 2 said none is good. The same as my church is your friend or something. And then you are good, like you are blessed, man. Like so many questions. Everybody just
okay. Let's relate this to African setting, Edo State. People with diabetes, how can they control it in such an environment that is different from the West?
I trained in Edo State. I did my house job in Edo State. I did my youth service in Edo State. I worked for a couple of years in Edo State before I came abroad. So we have been managing diabetes for so long. It is not new. I know that, I have to state this fact. I have lived with family members with diabetes, way back. Like we always say, medicine has not changed. But the people who take the information, there is a lot of information out there, people have myths, people have truths and untruths. But in a place like Edo, there are still trained physicians. I trained at the University of Benin, and they still got lots of clinicians who are able. Also, not just in University of Benin, in the private sector, there are lots of clinicians who are able to manage diabetes. All I will ask my people is, please seek help. Authentic clinician help. It's so important. It is so important. Especially when your sugars are good. We notice that even here. The sugars are good, the patients start to stop their tablets. They start to say, I'm hypo. I mean, some patients say, oh, I'm hypo. And I said, did you check your sugar? She said, yes. And I said, what was it? Oh, it was 8. I said, well, that's not hypo. Hypo is when it's 4, less than 4, So seek help of a clinician. Don't manage yourself because it's such a complex disease. But it can, if you do all the things, if you follow the rules, most of the time, people are able to live healthy lifestyle. Okay?
Thank you very much.
Well done.
Well done.
Okay, let me read Dr. Obano. Hello. Okay. Hello, Mr. Felix.
Yes.
Okay. You have anything to add?
Oh no, it's fantastic. I'm thrilled.
Me too. I learned a lot from today's
I was
program.
just enjoying myself.
Thank you
Yeah,
so much.
I said it all, and
Great presentation. Great.
yeah, everybody one way or the other.
Yeah.
I think at the end of the day, she's done the delivery, and if people have the further clarification.
Hello, can you hear me?
Hello?
I'm getting cut off on and off because of where I am.
Oh,
Okay.
Yeah, we can hear you.
Hello.
Now. We can hear you.
I would just say if you want to just push a few more points, that when should they go and get an eye exam? When should they go get a foot exam?
Okay. At diagnosis, we always stress on an intensive education program. At the same time, we say once a year, go and see an eye specialist for an eye camera test. This is to look at the back of your eyes. That's so important. Okay, to make sure that the blood vessels at the back of the eyes are not inflamed. We also advise to see your optician every year because you may need a change in your prescription. They can measure your pressure as well. Okay. Now, also at diagnosis, they get an appointment with the diabetic nurse or the healthcare assistant. And this healthcare assistant examines the foot. We examine the blood supply, the top of the feet, both of them, for there's an artery called dorsalis pedis artery. We want to make sure that there is pulsation. You only need this once a year. Now, we also have a little plastic, a flexible plastic called the monofilament. And once a year, when you attend the nurse, the nurse will also check for sensation at the bottom of your feet. So underneath your thumb, underneath the remaining 4 feet, and then underneath the foot. You shut your eyes and you say yes if you can feel the sensation. This test is done once a year. Now, if the nurse notices any abnormality, you are sent off to your doctor who can decide to do further checks and refer you to the foot specialist. We also want all diabetics to see a podiatrist once a year. We advise them not to cut their nails themselves because 1, their eyesight is not very good, and 2, they can cut their nails and cut part of their toe. There is problems with healing, so we advise that.
This is an excellent presentation.
Thank you.
And I think we have to find a way to get this to ITV so that our people can really see, because diabetic is a or diabetes is a real big issue that we need to focus. And then I am going to say that I'm presently working with the committee as well as Dr. Adesua, so that we can provide some support for our people in Edo State. So hopefully, as we progress along, we should be able to, provide some support to help lessen the burden on some of the providers back home.
That's important. Well done.
Yeah, that is very important, Dr. Obano, because you know that here we live in the West. It's very easy to get treatment and control or manage diabetes. But in Nigeria, it might not be the same because of the lack of healthcare system in the country. So supporting our people back home is very essential and important right now. Thank you, Dr. Obano.
We are trying to put a team together, a team with psychologists, foot doctor, eye doctor, and then we can proceed with supporting and help, taking the burden or, lessening the burden of some of the practitioners back home.
Thank you. So any comment, Dr. Dorothy Ayala, go ahead.
I think this is an awesome topic. Thank you so much, Dr. Adesowa, for a great presentation. As you know, diabetes is the prevalence of diabetes in all over the world is very high. In a clinical practice, 30% of my clients are diabetic. So it's very prevalent in our Black community, like you rightly said. So I would just add that if you're diagnosed with diabetes, it is important that you see your clinician every 3 months, because we usually monitor your blood sugar or A1C every 3 months. And a big component of managing blood sugar is also linking you up with a dietitian. Dietitians are nutritionists that are very, very good at helping you what type of food to eat, portion size, to help control these blood sugar level. It's very, very important to link up with the dietitian as well. And also, I will say, if you are diabetic, you need to have the blood glucose glucometer, where you can check your sugar at home by yourself. The best time to check it is in the morning, so that you keep an eye on how the medication is working, your lifestyle changes, how they are working. And also, especially when you are on insulin, it is very important you check your blood sugar in the morning, so that you know when to take your insulin, how to take it, the amount you need to take. So this is a very, very excellent presentation. Job well done. I'm so proud of you. And I know a lot of people will benefit from this topic.
Thank you so much.
I have one question, Dr. Adesuwa. During your presentation, despite that I was busy, something echoes to my ear that diabetic patient needs a kind of a sugar during a certain period. I hope you said that.
Yeah. Are you talking about, well, they may need, if listen, they are prone because they have insulin. Sometimes, yes, sweeteners, they can have sweeteners, so they are tea instead of sugar. But also, if they are exercising, if they've gone for exercise, and they've had their insulin, they may go into what we call hypos. They may have hypos. And so we always tell them to have some dextrose tablets, so that when they feel that morning, they can quickly take it. Because when you exercise, you utilize more glucose. And so you can become hypoglycemic. So your sugar drops.
Okay, then you need sugar immediately.
Yes. Just a little bit,
Yeah.
Also, just to throw something in the pot there. As a gastroenterologist, I see quite a lot of diabetic patients who come in with diarrhea. And this diarrhea that they come in is secondary to the sweetness. So the sweetness, one has to be also very, very careful with the sweetness. Because this sweetness will give you diarrhea, like sorbitol, which is the main thing, a lot of sweetness. So one has to be very, very careful also with them.
Also, talking about diarrhea, Dr. Bano, autonomic neuropathy will cause
which is a diabetic diarrhea. Yeah,
the diabetic, that's also a common cause of diarrhea. In diabetic. Yes, sir. Mr. Adige.
I just want to say, there are different kinds of, this is dextrose 4. The tablets, just put one in in your mouth, and it dissolves fastly and help to prop up, because excess of sugar in the body system is a problem. And unnecessarily low. It's actually more deadly than hypoglycemia. So it's always advisable. They are found in pharmacies, and maybe some doctors will have them in the office. It's always advisable, irrespective of any other side effect, to have this in the every diabetic patient that is on drugs or insulin. They must have this in their handbag or in their pocket.
So it helps to.
Dextrose 4, they come in different brand names. That is dextrose. It's like a kind of sugar.
It's a sugar.
They are sweeteners.
So why do they need sugar when they already have excess sugar in their body. That is why I'm confused here.
No, they need it. Once we started treating them with insulin, right? They are always told that they need a certain amount, but especially when they go and have exercise. A lot of them, when you exercise and you're already taking your insulin, your insulin requirements, and there's no, your body utilizes the glucose in the blood as its fuel. Okay. So it soon dwindles, it soon gets to nothing, and they start to feel ill. Okay. Now, can I tell you, there's a fad for exercise now in the world. So even patients who are not diabetics, who do vigorous exercises, we are told strenuous exercises, they all know that. I'm sure a lot of young people listening to me tonight, that after 45 minutes of vigorous exercise, you should have some, sugar related products.
Electrolyte,
Just to not replace your energy loss, after so the same with the diabetics. Exercise breaks down, it dwindles, it uses up the glucose in their blood, and so they soon start to feel ill because the sugar goes low.
Okay.
And also, people who are alcoholics are also prone to having this hypoglycemia, the day after the night before, they are very low, they are very weak, their blood sugars are sometimes reading 2 or 3, because of alcohol does cause hypoglycemia as well.
Wonderful. Thank you.
Thank you very much.
Thank you very much.
Wonderful presentation
The job
today.
well done.
You're welcome.
I think there are a lot of comments here. People are still leaving comments. On the telephone, if you are watching right now and you are willing to call in, just call in, because I'm on the phone for the past 20 minutes. So if you want to call back, there are a lot of comments today, honestly. A lot. I think most of them are just commentaries, not questions. Yeah, commentaries.
Some churches that put out they put out something for their members to watch today. A lot of churches in Benin.
Okay, so I'm glad to be of service.
Maybe that's why we're having a lot of comments.
Yeah, we are going to be having more because a lot of people now are getting more into this program to educate themselves.
No,
and also, I feel very privileged to work with groups like this and presenters like this who take this thing into heart, put in the time to do the work. And if every one of us in Edo State continue to contribute, you don't have to be a doctor, you don't have to be a lawyer. I think in the next several years, that state will become like England or Little England.
There are questions here.
Some of our traditional food are contributing factor to high diabetic and cholesterol. Please advise.
Advice, yes.
There are questions here. There are many comments. I think I have to check the questions. Ma, have you been checking the comments properly? There are a lot.
Well, for Amos, thank you for your question. Yes, you are right. Some of our traditional food are contributory to high diabetes and cholesterol. What I would advise, and I said it before, is to, your food, cut it into 3, your pounded yam or your eba, or your yam, so that if you were going to have 6 slices of yam, have just 1.5 or 2 slices, okay? And then you can, if you are eating it with vegetable soup, fill your tummy with lots of vegetable soup. If there is beans on the side, have lots of beans, is what I will say. Reduce the amount of oils that you use, red palm oil. Reduce that amount, okay? So it is a portion size now. If you Google portion sizes, you will see, you will see food plates. It's all over the internet, that can tell you how, your portion size. The carbohydrate should be a quarter of your plate.
Mm-hmm.
The protein, the carbohydrate should be a quarter.
A
The
quarter,
protein
yeah.
should be, a
A
quarter.
quarter.
You know, the vegetable should be almost 2/3 of your plate, and then the fat should just be 1/5 of your plate. So that's how you should. It takes discipline. It takes discipline. It does take discipline. Gone are the days where we say, of course, any food that has sugar, like cake, fizzy pop, soda, we say avoid it. But otherwise, I would not tell anybody not to have rice. All I will say is your normal portion of rice that you will normally have, get a smaller plate. Have about a quarter of what you will normally have. It takes getting used to, and bulk up with vegetables. So make sure, your efo, or if you like salad, your beans, have garden egg after, those sort of thing. You will need fiber to bulk up. Otherwise, you will be hungry.
Okay, I have one question from what you just said. When I was pregnant here in Canada, my dietitian, she's from Africa. She advised me to stay away from palm oil. This our African palm oil. That is very bad. The fat from the palm oil is very bad. You just mentioned something like that now, that they should stay away from palm oil. So, do you think our African palm oil is not healthy?
It's polyunsaturated fats. In moderation, not the dropping one. You can make you can add a very little bit. But if you like, some people are innovative. When they want to make a goosey soup, they, instead of putting palm oil, they actually use
Tomato paste.
bell
Olive
pepper.
oil. Yeah.
They use bell peppers to color it, and then they now put, olive oil or, sunflower oil. So it's being innovative. It's being innovative. But if you must, then just a little. The idea is not to stop these food choices, food types. They are important. We don't want to completely stop, but just a little. It's moderation and it's discipline for the stomach.
Another one question here. Is there a link between diabetes and what is this, cataract?
Yes.
In the eyes?
Yes, this is my friend. Yes, there's definitely a link between diabetes and cataracts. Okay, yes, there is. Yeah, there is a link. Cataract is opacity of the lens, and I will break that down. In the eye, we've got a lens where we see through, just like you will have your lens that you put on your spectacles. Inside the eye is the lens of the eye. And that lens can get hardened. That is what cataract is. It gets hardened, it gets discolored, it's normally clear. There is a link, a very big link between diabetes and cataracts. Yes, Lisa. Thank you so much for that
There's
question.
a second question there.
And is there a reason why doctors do not operate on cataracts in the diabetic patient? Lisa, again, I will say cataracts have to be matured. So not that they will not operate. They probably, the reasons they will not operate are if your diabetic control is poor. They would want to stabilize that. Nobody will operate on you if your diabetic control is poor. The second one is cataracts have to mature. Okay, I'm not an optician, but I've had a lot of people waiting for their cataracts to mature before the ophthalmologist, the eye specialist, does the operation. So that's why they would not do it. I suspect the first reason is if your control is poor, nobody will operate on you. They will tell you to go to your clinician to get the diabetic well controlled. Yeah.
The question is just so much. Mrs.
Show some.
If you can read it, ma.
Read what? I read some before, and you and Mr. Felix said no need. Somebody was asking and answering questions, so I don't think we'll...
Anymore. I'm happy to answer.
Okay, instead of dextrose, is it better to take orange juice?
No, I don't like. I mean, what I tell my diabetic patients, I said, look, you can give yourself a treat. Maybe on a Sunday, have half a glass of orange juice. But
Okay.
I would not, because that is one of the reasons why they never get control. Especially the shop bought, but even the orange juice you make at home. It's fructose is the fruit sugar. It's a natural sugar. And where we are struggling with diabetic control and the patient insists that they are eating all the right things, you find out that once you delve into their diet, you find out, oh, they're always drinking fruit juice. A lot of, there are a lot of additives that the manufacturing companies add to these fruit juices, and it's bad for your sugars. It's bad for your sugar control.
There are many questions here, honestly.
Okay.
This one says, Lekwen, please, how can we access this presentation at the
We
end
did
of the
that
program?
before.
So this
We said that we are
presentation
going to post it.
is okay. Yeah, I mean, okay. Do you mean the presentation from Dr.
Yes.
Okay.
Dr.
So,
Musa
Dr.
Iweje.
Yeah, Dr.
If you want to see it again, a few people ask the same thing.
Yes,
And then that's when I asked her, and she said it's okay to post it.
Yes, I will repost it, and this program as well. You can rewatch it from the beginning again, because this program is going to be on YouTube permanently. Okay, so you can go back and watch it over and over again. It's still the same thing. Okay, so but I will still do a kind of a picture format of the entire presentation from Dr. Adesuwa and post it on Facebook, and only Facebook I can post it. So this presentation is here on YouTube. Just watch it again after the program. Go back from the beginning, rewatch it again. You can watch it over and over again. It's there for you. So let me just.
There's one from Success Osai Bobo. He said, Dr. Adesuwa, please, since the diabetes in one's body becomes inefficient, diabetes or insulin, I'm not sure. Anyway, as one grows old, is there any way we can prevent it from being inefficient, ineffective? Sorry. I don't know if she meant diabetes or insulin.
She means, I think she means, or he means, Enoma means insulin. Thank you so much, Enoma.
Okay.
Yes, as we go older, actually the beta cells die off. The beta cells of the pancreas are the cells that produce this insulin. And yes, as we go older, unfortunately, they actually die off. Okay? That's why, hence, we saw in that presentation that most people over, 1 in 6 people over 65 have diabetes. But relating to the insulin not functioning well, one way we can stimulate the insulin to function well is to make sure that we reduce the fat in the middle part of our body. That is so important. Weight loss, but especially in the middle part of the body, we do need to reduce this.
To lose that.
So there's one question here. What are the consequences of developing?
I already asked this.
And what diabetes was 1 or 2. Yes, Enoma, thank you so much.
Enoma has a lot here. What are the
blood vessels?
Yeah, this one.
You could just see how important this topic is. Because the question, and not only that, the presentation is so great.
Yes.
Thank you so much. Now, Enoma, thank you so much for your question. You said, what are the 2 major concerns of diabetic complications? I think it's the macrovascular, so the heart disease and stroke. That's so important. That's the commonest. When I counsel people when they are diagnosed, and I tell them that, they say, oh, it's just sugar. And I said, no, it's actually heart attack and stroke. That's the most important thing. So that's why, 1, you don't want to get diabetes because it increases your risk of heart disease and strokes, of heart attacks and strokes. So you don't want to. They are the 2 major ones. And you said people with diabetes are 2 times more likely to have heart disease or stroke as people without. Yes, because of the blood vessel problem, the hardening, and then the blindness in the eye.
And the blood is not circulating properly.
It's not circulating properly. So they get poor circulation, they get numbness, they get infection, the flesh gets rotting, and they get gangrene, and the foot is cut off. Yeah.
I think I have to go to medical school now. I have to. I'm so impressed. Dr. Bano, Mr. Felix, Dr. Adesua, Dr. Dorothy, you people are inspiring me right now. I have to go to medical school. Oh my God.
It's never too late, my dear. It's never too late. Thank you so much. Thank you. It's been a pleasure being here to share my knowledge, to support my people, to let you know that we are thinking of you, and to support this course, that Dr. Obano and my auntie, Mrs. Obaseki, is setting up. It's a worthy cause. It's a laudable cause. So success. Society Bible says, Dr. Odesua, please, since the diabetes is one body becomes ineffective, is there any way we can prevent it from being ineffective? Or is the insulin? We've answered that. Thank you, success. That.
I think it's the question.
Thank you very much.
Thank you so much.
Finished.
Thank you.
We are done with the question.
Thank you all.
Yeah. Thank you.
So in 2 weeks' time, we're going to be having a ball again in this presentation. We are going to be having a very good presentation coming in 2 weeks.
Okay.
Thank you.
Dr. Adesua, thank you so much.
This next presentation is going to marry into this diabetes so that we continue to bring this to people and let people know. Earlier on in this program, we talked about aspirin, and today you brought up aspirin again. So as we continue to go, we will continue to bring all these things into focus. And I am so proud and so thankful to you for your presentation.
You're welcome, sir.
Thank you very
Pleasure
much.
being here. I thank God for this season.
Yeah.
Thank you so much.
Thank you. Thank you very much.
Sister Nekman, do you have any more? Yeah.
Nothing more than thank you to everyone. Those who left comments, wonderful comments in the comment section as well. Our viewers,
many of them.
Our viewers today, everybody, thank you so much, Dr. Adesua. Thank you. I love your passion about this topic. The way you are explaining it, your body movement, the chemistry.
Oh, thank you.
Oh, awesome presentation. Thank you so much. Mr. Felix, thank you. Mr. Felix, hello. Can you hear us?
Mr. Felix, yes.
Thank you. Thank you
I see you now.
Let me bring him to the screen. Mr. Felix, you are always busy. You're always busy.
He's a busy man and it's a busy season.
Yes, thank you. Thank you so much. Thank you.
And also Nekman sometimes, most times.
Me too. I'm busy.
Yes, you are a very busy girl.
Yeah.
Thank you so much. Thank you, Dr.
Thank you. Thank you. God bless you.
Thank you, and
thank you very much. We are proud of you.
Bye, guys.
Have a great weekend.
Okay,
Have a great
bye-bye.
weekend.
Yeah.
Bye, everyone. Bye.
Thank you.
Edo must move forward. Move forward. Backward never. Yo.
Edo Professionals in Diaspora program is a team of skilled and experienced Edo professionals in diaspora who are willing to use their professional skills to support and effect change in Edo.